Up Close with Chris Williams is presented by Tennova Healthcare, with 6 hospitals and more than 1,000 dedicated physicians. For more information, tennova.com.
Welcome to Up Close. I'm Chris Williams. Almost everyone has a family member, relative, or close friend who's been affected by heart disease. Worldwide, heart disease is a consistent killer. And here in Tennessee is a physician and cardiologist whose important research into this epidemic is helping the world to better understand this disease. Dr. Malcolm Foster is responsible for conducting cutting-edge research into heart disease and cardiac arrest, or in simple terms, heart attacks. The Tennessee-based cardiologist is sharing his findings, techniques, and modes of treatment with his cardiology peers who travel to Knoxville from all over the world. They share a common goal with Dr. Foster, to learn more about how to save the lives of their patients. When I spoke with Dr. Foster, I first asked him about his background. I wanted to go back, first of all, to your early years in your life and let our viewers at home get to know a little bit about you personally. Tell me, where did you grow up and spend your childhood?
So mostly I grew up in Jacksonville, Florida, and had good role models in terms of my becoming a doctor. My grandfather was a doctor. My father is a doctor and still practices in his 70s. My uncle is a doctor. And my mom is a professor. She teaches nursing.
Wow, so it's all in the family, huh?
A lot of us, yeah.
I wanted to know, at what point was it in your life that you developed an interest in cardiology?
Well, in medical school, you rotate through all the various specialties, and I really enjoyed each and every specialty. And I thought I could be a pediatrician, or I could be a psychiatrist, or really all the areas of medicine. But particularly cardiology, and particularly the idea of treating a heart attack was very appealing to me. It was a real crisis situation, and you intervene on a heart attack, and the patient really has life restored to them right before your eyes. So it was very exciting.
Have you had family or friends that have suffered from heart disease?
Yes, I have, like everybody has. So family members, colleagues, people that I work with in the hospital, and of course, many, many patients.
Let's talk about your incredible credibility. And tell me about maybe your undergrad education all the way to your advanced studies, because it's very impressive.
Well, thank you. So I went to college and did undergraduate at Duke University. And then I went on to Wake Forest University for medical school. It was called Bowman Gray School of Medicine at that time. I did internship and residency at the University of Maryland, and that was in internal medicine, and then went to Vanderbilt University for cardiology training. I did some additional training in Boston after that for peripheral vascular disease, and then started my career in Michigan, and worked in Michigan for 4 years before coming to Knoxville.
When I was doing my research for this interview, I couldn't help but think, wow, with your education experience, you could probably work in any place you wanted to. What has kept you in East Tennessee?
I love East Tennessee. I moved to Knoxville in 2001, and I tell you, I can't imagine a better place to live and to work. So we have friends and family and professional, wonderful professional life here. The University of Tennessee and all the activities, and of course the great natural surroundings that are here in the community activities and things like that. So I really love Knoxville.
Speaking of East Tennessee, you are credited with spearheading research that takes place right here in East Tennessee that can have effects worldwide. Doesn't that give you a sort of sense of pride that you are doing that right now?
Sure, absolutely. Traditionally, a lot of cardiovascular research has been done in university settings only,
right.
But when I came here to Knoxville, one of the appeals to me was that the physician practice and that the hospital was a very busy cardiovascular center. So maybe unfortunately we have plenty of cardiovascular disease in the area, and that's something that we are working against every day.
Right.
But it meant that we had a very active group of doctors at a very high level, very experienced doctors and with great expertise, and that made for a wonderful setting to then conduct cardiovascular research.
Wow, that's incredible. Now, when you first came here, you worked for Baptist Hospital.
Yes.
And you were the principal investigator. What is meant by principal investigator?
I had responsibility for the conduct of clinical trials. And so for our patients, to undergo a clinical trial is something new and different, as opposed to you go to the physician, you work with your physician, you get advice from the physician on what the best treatment options might be. But with clinical trials, we tell people we're not sure what the best treatment option is, and that's why we're conducting the trial, is to help determine for them and for future generations what are the best treatments. So with myself, my partners became sub-investigators, and our patients, the ones that volunteered for clinical trials, became clinical subjects.
Changing gears here a little bit, I know that you are involved with utilizing novel cardiac devices. So what are coronary balloons, and how do you actually use those in treatment?
So with intervention with blocked arteries, balloon angioplasty was the first treatment that was started that allowed the blocked artery to be reopened and to restore blood flow. And we've gone through a progression. We've gone from balloons to stents to drug-eluting stents or medicated stents. And we are in about our 8th generation of device now that we use for patients. And so things are so much better than they were in the beginning, which was about 2 decades ago.
What are some of the many causes of high blood pressure?
Well, there are certainly some genetic causes. In other words, there are some families where high blood pressure tends to run in the family. But there are a number of behavioral aspects as well. And so we have people that are overweight, they don't exercise properly, the diet is not optimal, particularly with the sodium or salt intake in the diet. And all of these things contribute to high blood pressure. High blood pressure in particular is a risk factor for stroke, and here in East Tennessee, we call the stroke belt. We are part of a concentration where stroke is higher than the rest of the country.
Right here in East Tennessee?
Yes.
What are some of the, I guess, medications or drugs that are now used or maybe commonly or popular to treat high blood pressure?
Well, fortunately, we have lots of choices now with blood pressure medication. In the past, it was, some people thought the treatment was worse than the disease, meaning that taking blood pressure medicine was miserable, and that was not at all unusual. Now we have so many different choices with blood pressure medications that for many people, they don't even know they're on a medication. It's just that their blood pressure is now under control, and they don't have the risk that they had for stroke, heart attack, kidney failure, other consequences of high blood pressure.
Now, cholesterol plays a vital role here. And I guess in layman's terms, would you explain to our viewers at home the difference between the good cholesterol and the bad cholesterol?
Sure. Well, that cholesterol is critical. We talked about blockage.
Right.
Blockage is really cholesterol plaque buildup in the arteries. And so the high levels of cholesterol in the bloodstream is what leads to cholesterol plaque buildup in the arteries. We do have good cholesterol and bad cholesterol. The good cholesterol is the HDL,
right,
and the bad cholesterol, there are several, but it's the LDL and triglycerides. And we want to boost up that good cholesterol because it helps to clear the bad products, and we want to lower the bad cholesterol as much as possible.
How have the high blood pressure meds changed over the years?
Well, the high blood pressure medications are much more effective now with fewer side effects. So in the past, we had a limited type of blood pressure medications, and the side effects tended to be fairly severe. But now we have medications, and we also have combinations of medications. So a single pill, for example, may have 2 or even 3 different medicines that work complementary to each other. So a person can take one pill and get small doses of 3 different medicines that work very well.
So you could get something that treats high blood pressure and maybe high cholesterol at the same time.
We have that as well. That's right.
Are there a lot of meds for high cholesterol?
There are not as many medications for cholesterol as for blood pressure. However, we have a number of them. And for example, one of the mainstays of therapy is a category called statins, statin medications. And the statins lower the LDL, or the bad cholesterol in particular.
I want to ask you about some of your research, because I know that you've done research with what is called the Widowmaker of the heart. What is the Widowmaker of the heart, and what have you learned about it?
Yeah, so unfortunately, kind of an ugly nickname, but the reason for the Widowmaker refers to the main trunk, the left main trunk. And it gets that nickname because if a person has a heart attack involving the main trunk, it's very difficult, if not impossible, to survive. So you can imagine that treatment, if you have plaque buildup and blockage there involving that main trunk, that treatment is absolutely critical, because if the treatment were to fail, then that is probably going to be lethal for the patient.
Now, you have offered a lot of training here at Tennova's Turkey Creek Medical Center for physicians across the country. Tell me about some of that training that you've actually offered.
We started this at Baptist downtown,
Right.
and then came out to Turkey Creek. And it's been a real pleasure. We've had physicians from almost all 50 states in the U.S. come in from different specialties. And we demonstrate and lecture, and they observe procedures, and particularly the advanced endovascular procedures. So these are minimally invasive procedures, catheter-based procedures, non-surgical treatments.
Do you enjoy mentoring others in the healthcare profession?
Absolutely. I told you I really come from a family of teachers.
Right.
Mom's a professor, dad's a professor, and so I think it must be genetic with me, but I definitely enjoy teaching and continue to do that today.
I wanted to ask you a little bit about the Excel cardio research trial. Primarily its importance and its success, and how you actually chose the patient from Seymour, Tennessee.
Sure. Well, the Excel trial addresses that issue of blockage of the left main trunk, or the Widowmaker lesion. And for good reason, the standard treatment for patients with that condition is to have open heart surgery and a bypass. And open heart surgery and a bypass has been life-saving for people, and we continue to use that treatment. However, to make progress in the future, we're looking at patients that might be appropriate to have a stent there rather than open heart surgery. The advantage for the stent is that literally we could place the stent that morning, they could be home in the afternoon. And there's no incision, and there's very little impact on the patient. However, we need to ensure that the long-term outcomes are comparable to open heart surgery, and that's the reason for the clinical trial. The patient from Seymour had that type of blockage involving the main artery, and we talked to him about the alternatives, the risks, the benefits, the alternatives, and we offered him the clinical trial, and he agreed to participate.
And that's been very successful.
Yes,
thus far.
yes, it has, and this is a trial that's taking place in the United States and around the world. It's a multi-centered trial, multinational trial, and we're having great success with enrollment and with treatment of our patients so far.
How do the types of treatment here in East Tennessee differ or vary from maybe others across the country? And another part of that question, here at Tennova, the treatment that is offered, how does that compare with some of the other medical centers across the country?
Well, we provide state-of-the-art treatment in our community And here at Tennova, we're one example of that, but we really offer state-of-the-art care in many specialties, but we're talking about cardiovascular disease today.
Right.
And in fact, beyond standard of care with the clinical trials, we offer new technologies, new drugs, new devices that are not on the market yet that may offer some advantage for people. There are very few reasons that a person would need to leave the area for cardiovascular treatment. One example would be a transplant. So occasionally something like a heart transplant may be appropriate for a person very sick. And so we would refer that patient to a transplant center. But that is one of the very few exceptions where they would need to leave our community for cardiac care.
Is there an average wait when you refer someone to a transplant center?
There is a wait, and with heart transplants, it's on average of about a year to get a transplant.
What is the ideal age for someone to maybe begin checking their heart rate and their blood pressure? Is there a specific age you recommend that people become more conscious of that?
Well, believe it or not, even early on, school-age children, it is worthwhile to just check the vital signs, to check the heart rate and the blood pressure, and to check the height and weight. So we have a program of preventing heart disease now really starts in children. Height, weight, avoiding obesity, eating healthy, checking blood pressure. And then as a person moves into adulthood, you can check things like the blood sugar. You can check cholesterol levels. And that's something that can be done with the physician with some fairly simple blood tests. As we move into middle age, then that's when we might think of additional testing, which would be something like a stress test.
There's so much to learn here, but I mean, wouldn't you agree that for someone watching, even though there is a lot to learn and maybe to be concerned with, that you shouldn't let that frustrate you because of its importance?
Yeah, if anything, we should simplify our lives a little bit.
Right.
And the complexities of modern life, I think, affect us all. They affect me, affect everybody. But heart disease, you know, they say, I want to know, I need a manual, how to prevent that heart disease. And I say, well, you really don't need a manual to prevent that heart disease. You need to simplify your life a little bit. And it's easy to say and hard to do. It's going to the grocery store, going into the produce area, getting fresh produce, and then leaving. And then when you leave, go do some exercise. Go outside and have fun, run around. So, you know, eat healthy, exercise, take care of yourself, keep your weight down. Don't smoke is a big one.
Right.
We didn't get a chance to mention that. And then things like taking care of blood pressure and cholesterol and blood sugar.
You are, according to so many of your colleagues, regarded as someone who has true compassion for his patients. Why is that important to Dr. Foster?
You know, I just think that comes from family values. Family values, role models in my life, my parents, teachers, other physicians that I followed along the way, and just treating a person the way that I would want to be treated, or the way that I would want my family members to be treated. And I tell you, that's a real privilege and a pleasure to do that. It doesn't feel like an obligation.
You're also president of the nonprofit foundation East Tennessee's Cardiovascular Research Foundation.
Yes.
Did I get that right?
You did.
Tell me about that foundation and maybe how it's helping or benefiting others.
Well, I'm very proud of that. And this is actually a foundation that started through the hospital system, and then we took over independent control of the foundation. And it's a not-for-profit side. So instead of the employment side of being a physician, this is a chance at giving back to charity. And so we have programs both in East Tennessee, like the Cardiac Kids program that is for prevention of obesity and prevention of heart disease. We have Cardiac Kids here in East Tennessee. We have programs outside the country, for example, in Haiti area, where we've been able to do open heart surgery for children that would never have had that option, but we've been able to contribute financially.
That's incredible. You've also been recognized for your achievements along the way, for your research, for many of the articles that you've written. So I have to wonder, do you have any future goals you might share with our viewers at home?
Absolutely.
Okay.
We've made progress.
Right.
We've made great progress. If you look back at the type of treatments that we had before to what we have available now, we've made progress. But we have so much more to do and so much more to accomplish. And certainly throughout my entire career, and I think about my children and their careers. So we have so much more to go. And in some ways, the advances in medicine contrast with the overall health of the community. We have some issues with the community being overweight and having a development of diabetes, for example, that we're battling with. So we certainly have plenty of opportunity as far as I can see.
One of my next to last question, someone watching right now, maybe they've been having chest pains or they have a concern, but yet they're scared to know. What advice would you give them about coming in and finding out if there's really an issue there?
Yeah, I would encourage somebody to take care of their health and to look into any issues that might indicate cardiovascular disease, that might indicate impending heart attack. It's much better to treat somebody as a matter of prevention than to have to treat them as an emergency and rescue them from a heart attack, for example. So we'd much rather be aggressive toward prevention than in the case of an emergency. And the treatments now are very well tolerated. It's minimally invasive. There's much less in the way of open surgery. It's available when needed, but the treatments are minimally invasive. Most things we do as an outpatient. Person comes in, they have a treatment, procedure in the morning, they're home in the afternoon. It's very little impact.
We are here in East Tennessee, where the area is known for all the research hospitals, all the medical treatments that are available here. And I noticed that you brought in one of the medical students with you today to watch this interview. If someone is watching right now and it sparked an interest in them and maybe they're considering the study of cardiology, what advice would you give to them?
Well, I would encourage a student now to look into healthcare as a career. It's a wonderful career. There are a lot of ways to do it. You can be a physician, you can be a doctor, you can be a nurse, you can be a technologist. There's a lot of ways to participate in healthcare. It's a wonderful career. We help people. I can't imagine doing anything else. And I would do it all again today, despite the fact that some things have changed over time.
Thank you so much for talking with me.
Thank you.
And wish you much continued success. A real pleasure.
My pleasure.
I want to thank Dr. Foster and his team for accommodating our crew. I hope you will take heed of the things you learned from him. The sooner heart disease is diagnosed, the better chance of a positive outcome. It is those who pioneer research who give us much needed knowledge for the future in medicine. And when new treatments become available, they can help many in need. This is one of the many reasons why, on several occasions, Up Close will explore an issue in medicine. Hopefully, this will educate and help many of you, our viewers. Thank you for joining us. Up Close, I'm Chris Williams.
Up Close with Chris Williams is presented by Tennova Healthcare, with 6 hospitals and more than 1,000 dedicated physicians. For more information, tennova.com.